Hello, thank you for looking at my Pinterest. Pinterest pertains to maternal as well as neonatal health in the US today. A little bit about worldwide information as well. So, this is about maternal stress and how it can affect neonatal birth weight as well as mortality rate. Let's start with the definition of stress. The meaning of stress is defined as an adaptive response to an external situation that results in physical, psychological, and or behavioral deviations from organizational participants. So basically from an equilibrium, you regress away from a norm, so your homeostasis is tipped off. So therefore your body goes into fight or flight, and of course this is how stress affects your body. Short term effects include feeling worried, nervous, or unable to switch off, heartbeats faster and pump more blood to major muscles through vasoconstriction, breathing problems, tummy issues related to slowing down of peristalsis, as well as skin becoming more sensitive and oily, as well as problems between the sheets, meaning with continence. Sometimes people let it go, or sometimes people have a hard time going, and your muscles tense. So, as a result, with all this tension, long term effects include headaches and migraines, as well as mental health problems, serious heart problems, trouble breathing, hyperventilation, panic attacks, skin conditions like acne and hair loss, as well as increased risk of type 2 diabetes, fertility problems, and so forth. So, how stress affects mom. Risk factors that may cause stress for pregnant women, other than the actual pregnancy itself, may include the mother being very young or very old. That sounds mean when I say very old. What I mean is probably above the age of 35. Some mothers even have children in their 60s. This can cause a lot of stress because this is unexpected, as well as too young, as in the mother being a teen mom. That's very stressful too because they're still a child themselves. Not having enough financial resources. So, if you don't have enough financial resources, how can you afford health insurance as well as other resources for education, maintaining health, and knowing what your baby needs while it's developing, as well as being a single mother and how the pregnancy occurred? So, how the child was conceived, it could have been domestic violence or rape, which is very stressful and traumatizing, and of course, the pregnancy itself again. So, for every dollar the minimum wage goes up, low birth weight goes down by 1 to 2%, and infant mortality goes down by 4% from the baseline. So, how do we add up to the rest of the world? The US, out of developed countries, has the highest mortality rate of neonatal, um, infants, according to 2010. This was collected 2009. But 6.1% compared to Finland's 2.3%. If this can go down 4 points, we would be lower than Finland if we just would increase minimum wage or give moms more resources. If we honestly just made things less stressful. In the US, we have such a habit of having such a fast paced, busy lifestyle. So, that's pretty stressful and a lot to keep up with, especially with demands at work, especially if you're a single mom. So, what are birth classifications? So, an average birth weight is 6 pounds 9 ounces to 7 pounds 11 ounces. A low birth weight infant or neonate is less than 8 pounds, 5 pounds 8 ounces, and a very low birth weight is less than 3.4 pounds. And then this is a baby, um, preterm, and low birth weight, because being preterm is a risk factor itself for low birth weight. And that's just an oxygen tube. This baby's in the NICU, and it's in a little um, box like thing to keep it warm. It can't stay as warm, and its lungs are probably not as developed. Its little hat to keep it warm too. And this shows ethnic differences in rates of low birth weight in the United States. This is infant mortality per 1,000 live births in 2017. So these babies passed away after the neonatal period of development. They were during infancy. The highest prevalence is in Black non Hispanic babies. And if you compare that to all races, ethnicities, as well as all the other races, the average in the middle is right there. If you compare it to all, that disparity is very, very obvious and very significant. Physiological processes of stress on a fetus. This can show how inflammatory cytokines and glucocorticoids can affect the fetus's development physiologically, and in turn, with the nervous system, can have the concept of later psychological consequences to be determined, as the baby grows. This can cause cardiovascular diseases, neurological diseases, and endocrine problems, like risks of type 2 diabetes, um, and with the neurological part, the glucocorticoids and cytokines being exposed to the baby, as well as their nervous system and body, this can damage these cells. And then when this stem cells are healing, this slows down the baby's development because the baby's constantly trying to keep up with its development. So that's how stress can affect the baby directly. Here's some statistics. The normal birth weight, of course, is greater than 2,500 to 3,000 grams. The low birth weight is, less than 2,500 grams, regardless to the gestational age. So a baby can be born on time and still be considered low birth weight. And low birth weight usually occurs in 15 to 30% babies, and neonatal deaths. 75% of neonatal deaths are due to low birth weight, and 50% of infant deaths after the neonatal period are caused by low birth weight. And of course, we saw the graph earlier of the disparity in African Americans compared to all ethnicities in the United States um, on 2017. So, complications of low birth weight includes malnutrition because some reflexes may not be present. That's especially with some neurodevelopmental things, as well as recurrent infection. Their immune system is not as developed. They didn't get as many antibodies as needed, and they're not feeding from mom, so that's important. And neurodevelopmental handicaps. And then this is an image of a baby with an OG or orogastric feeding tube going through their. Actually, that looks like nasogastric, NG, that is, but usually it's OG that I see. My experience of maternal health clinicals, as well as working on a mother baby unit as a secretary and tech for a little bit in the hospital. Um, but this baby has a feeding tube if it can't feed from mom. Um, so that's supplemental nutrition until it can develop that reflex. And if it can breastfeed from mom, which would be great because it would strengthen its immune system furthermore. And then there are ways to prevent postpartum complications with mom. Her health after the birth is important. It can start from an institutional level to community, postpartum care and follow up. Also, this reduces risk for diabetes. There's research being done as well as making sure to know it is very important to seek postpartum care. These steps show factors of maternal stress and how it can be prevented. It is important to deal with and face the source of stress as early on as possible. The general adaptation syndrome with alarm, resistance, and exhaustion, so that once a mother copes, she can relax, therefore protecting her health as well as the baby's health. So that is my Pinterest, and thank you for viewing it.